Global Health and Pandemic Preparedness, an in-depth analysis. Introduction. Global health and pandemic preparedness are critical issues in the contemporary world, shaped by the increasing interconnectedness of nations and the rapid movement of people, goods, and diseases across borders. The COVID-19 pandemic underscored the vulnerabilities and strengths of global health systems, bringing to light the necessity of robust preparedness strategies. This topic encompasses a range of disciplines, including epidemiology, public health policy, international relations, and healthcare infrastructure. Historical context. Past pandemics. Historically, pandemics have had devastating impacts on human populations, economies, and societies. Notable examples include the Black Death in the 14th century, which killed an estimated 25 to 30 million people in Europe, and the 1918 influenza pandemic, which resulted in approximately 50 million deaths worldwide. These events highlighted the need for coordinated responses and the development of public health measures to control the spread of infectious diseases. Evolution of global health policies. The concept of global health emerged in the 20th century, evolving from the earlier notion of international health, which primarily focused on controlling diseases that crossed national borders. Organizations such as the World Health Organization, WHO, established in 1948, played pivotal roles in shaping global health policies and responses to epidemics and pandemics. The eradication of smallpox in 1980 remains one of the most significant achievements of global health collaboration. Components of pandemic preparedness. Surveillance systems. Effective surveillance systems are the cornerstone of pandemic preparedness. These systems involve the continuous collection, analysis, and interpretation of health-related data essential for planning, implementing, and evaluating public health practices. The Global Influenza Surveillance and Response System, GISRS, is an example of an international network that monitors influenza activity and assists in the development of vaccines. Laboratory networks. Accurate and rapid diagnostics are critical during a pandemic. Laboratory networks, both national and international, facilitate the timely identification of pathogens. The WHO's Global Outbreak Alert and Response Network, GORN, supports rapid identification and response to outbreaks, leveraging expertise and resources from its partner institutions. Healthcare infrastructure. Healthcare infrastructure must be resilient and adaptable to handle surges in patient numbers during pandemics. This includes having sufficient hospital beds, ventilators, and personal protective equipment, PPE. Equally important is the presence of a well-trained healthcare workforce capable of managing infectious diseases under pressure. Public health interventions. Public health interventions, such as social distancing, quarantine, and vaccination campaigns, are crucial in controlling the spread of infectious diseases. The effectiveness of these interventions depends on timely implementation and public compliance, which in turn are influenced by clear communication and public trust in health authorities. Research and development. Research and development, R&D, play a vital role in pandemic preparedness. Developing vaccines, therapeutics, and diagnostic tools quickly can significantly alter the course of a pandemic. The Coalition for Epidemic Preparedness Innovations, CEPI, was established to finance and coordinate the development of new vaccines to prevent and contain infectious disease epidemics. Challenges in pandemic preparedness. Global inequities. One of the most significant challenges in pandemic preparedness is the disparity between high-income and low-income countries. Wealthier nations typically have more robust healthcare systems and resources to respond to pandemics, while poorer nations may struggle with basic healthcare infrastructure and access to essential medical supplies. Political and economic barriers. Political and economic factors can hinder pandemic preparedness and response. National interests may sometimes outweigh global cooperation, leading to delayed information sharing and unequal distribution of resources. Economic constraints can also limit the ability of countries to invest in necessary healthcare infrastructure and R&D. Public mistrust and misinformation. Public mistrust in health authorities and the proliferation of misinformation can undermine pandemic response efforts. Effective communication strategies are essential to address fears, correct misconceptions, and encourage public adherence to health guidelines and vaccination campaigns. Lessons from COVID-19. The COVID-19 pandemic has provided numerous lessons for improving global health and pandemic preparedness. Importance of early detection and response. Early detection of the virus and a swift global response could have mitigated its spread. Global collaboration. The pandemic demonstrated the need for enhanced global collaboration and resource sharing. Investment in health systems. Sustained investment in health systems is crucial for resilience against future pandemics. Vaccine equity. Ensuring equitable access to vaccines worldwide is essential to controlling pandemics. Strengthening surveillance. Strengthening global surveillance systems can help detect and respond to emerging threats more effectively. Future directions. Strengthening international cooperation. Enhanced international cooperation is critical for effective pandemic preparedness. This includes reinforcing the role of the WHO and other international health bodies, fostering transparency, and promoting equitable resource distribution. Enhancing technological innovations. Technological innovations, such as artificial intelligence and genomic sequencing, can revolutionize pandemic detection and response. Investing in these technologies and ensuring their global accessibility is essential. Building resilient health systems. Building resilient health systems involves not only improving infrastructure and workforce capacity, but also ensuring sustainable financing and governance structures that can withstand the pressures of a pandemic. Promoting One Health approach. The One Health approach, which recognizes the interconnectedness of human, animal, and environmental health, is crucial for preventing and managing pandemics. This approach encourages multidisciplinary collaborations to address health threats at the interface of these domains. Conclusion. Global health and pandemic preparedness are dynamic fields that require continuous evolution and adaptation. The lessons learned from past pandemics and the recent COVID-19 crisis underscore the importance of robust surveillance, resilient healthcare systems, equitable resource distribution, and international cooperation. By addressing current challenges and leveraging advancements in science and technology, the global community can better prepare for and respond to future pandemics, ultimately safeguarding public health worldwide.